return of COVID-19 cases in higher numbers some are now delaying the return to work. Many companies doing that. They're just pushing the date on the calendar back further and further. We get the employer perspective from Terry Stone, managing partner of the Americas for the consulting firm Oliver Wyman. Thank you so much for being with us. Appreciate it, Terry.
Thanks for having me, Lauren.
Okay, so you're based in Dallas and talking to executives in the region, and this is, it's a no-win situation again. It seems like, and we've been here before as well, but still there's not a right answer. What are you hearing?
What am I hearing? I think the biggest challenge right now is everyone is wrestling with what's the right thing to do in light of public health, but also personal liberties and freedoms. And quite frankly, I think people may look at it and think, well, why does no one have a plan? But I would argue that everybody got blindsided by Delta and the situation's changed a lot. So what was working in May at the level of vaccination we had is just not working anymore. It was fine to hold back the old virus, but as that virus climbed to 83% or 85% of all the cases, it's not enough. And so employers are wrestling with, most don't want to bring people back and have them sitting with masks for 8-10 hours a day. So the first thing you do is you try and push out, when do I bring you supposedly back to whatever our new normal is? Others are in very small numbers. You see some mandating of vaccines. It's not surprising in our region. Those are really only in rare instances right now. It's really the healthcare companies, the health systems. You're seeing more of that in other parts of the country. But right now, I would argue most people are hoping that we can stave this off and just delay return to work. What was September might be October. I think looking at the data, October might be a little further out, but I think that's what most companies are doing in the region while they're trying to figure out and make sense of what's happening.
Because a lot of people have been able to work from home. It's been pretty successful. They're at least getting the work done. And so putting that, putting workers at jeopardy, and you might have a lot of people who wind up out of work because they all get sick. So it's definitely like they've got to juggle and figure out what's the better thing. And then there's got to be concerns about, kids going back to school too, and what that's going to look like for a lot of parents and families.
Right. I think that's right now, kids are kind of the key. It's still pretty safe to assume if you're vaccinated, the risk to you is very low, but almost 20% of the population are kids who can't be vaccinated because they're too young or their parents won't take them to be vaccinated. They'll all be going to school. And so the biggest risk to parents and employers, quite frankly, there's some degree of severity of illness, but it's going to cause a lot of shutdowns like we had last year, where parents are suddenly having to be home while their child's on quarantine. And so that's, I think, a lot of what we're going to see in the uncertainty. And then we have the broader risk, which is if we don't vaccinate more and we let it keep spreading through, whether it's the schools, the workplace, anything, Delta variant's just one. There can be another one.
Right. Right. And then there's the whole mask debate, too, which a lot of companies and businesses simply don't want to get into. So, yeah, it's tough right now. Thank you, Terry, for your insight. We appreciate it.
Thank you.